Thanks for attending this morning. Just start off with a brief introduction of what we'll cover in today's presentation. So we'll give a brief overview and some context to the shielded patient list and how that came about. And then we'll cover the areas of the survey, so the demographics of the respondents, and then some of the key findings and the possible target areas for intervention that have come out of this survey. And then at the end, Jane will summarise our initial response and then the next steps. And as Jane said, we'll then do a Q&A session. So just some context, because I'm aware that there's a mixture of people on the call today, not just people in Somerset. So the shielded patient list for Somerset had around 27,500 people on it, identified as high risk. And the impact of shielding, I think we're all aware of what that would be. So months of isolation and confinement, can have an immense effect on physical health with a deconditioning pandemic expected, as well as mental health. So some context for Somerset, around 1 in 4 of the residents of the county are over the age of 65. So it's a real older and aging population, which is something to be aware of as we look at this data. And then the rural geography of Somerset and the issues that presents in terms of social isolation with limited transport, limited broadband, and those sorts of things, and just another thing to consider. So the shielded patient list mail out came about through the CCG, as Jane said, so we didn't have access to any of these people's data. This was sent out on behalf of SASP through the CCG. But the mail out included a cover letter from SASP and the CCG outlining what we do, a little bit about the We Are Undefeatable campaign that Jane mentioned. And also in there was an Active at Home booklet, which was either provided from Public Health England or the We Are Undefeatable campaign. And then the survey that we'll be looking at today with a free returns envelope. So the survey itself was developed by SASP. It was a brief survey, just 2 sides of A4, but covered a range of topics. So it wasn't exclusively physical activity. And this is just a list of the things that it did cover. So we covered demographics, health, digital inequality, obviously physical activity. And then we asked about barriers and motivations of activity. We also asked a few questions about the We Are Undefeatable campaign because we're a local activation area, so that would be interesting for us to know. And then, as I said, we didn't have the contact details of these people, but we were allowed to request those details if people were willing to receive a follow-up. So we'll talk about that towards the end as well. And we've had over 2,800 responses, and an over 10% response rate is really positive for this type of mail drop survey. So we're really pleased with that. It's given us lots of data to look at. So we'll start off with the demographics then. The ages actually ranged from 5 to 98 years of all the respondents. But as I said, with the makeup of Somerset, 85% of those respondents were 60 or over, and actually 2/3 were 70 or over. This is a population pyramid just to give you a breakdown of males and females and the age bands, and you can see that those in the 60s, 70s and 80s were the most frequent responses. And 54% of respondents were female, as you'd probably expect. And again, being Somerset, 99% of respondents were white. So with social isolation being a key contributing factor to health, we asked about household size because this was interesting to us. And 27% of respondents stated that they live alone, and only 12% living in a household of 3 or more. And this chart just gives you a breakdown that you can see there's a clear trend. The older you were, the more likely you were to live alone, which I'm sure you'd expect. And this was more so the case in females as we got to the older age bands. And of course, we asked about long-term conditions, and I'm still not fully clear on the criteria for the shielded list and how this was made up, and whether it was just those with long-term conditions or whether some of just the over 70s were included, whether they had a condition or not. But we asked the question, do you consider yourself to have a long-term condition? And if so, to list those conditions. And 90% of respondents did consider themselves to, but that did leave 10% of those 3,000 that didn't consider themselves to have a condition. And again, this is a breakdown of those numbers of conditions. So the amount of people who reported no conditions, 1, 2, 3, and 4+. And I think the takeaway message from here is that if you add up all of these people with 2 or more conditions, it's more than half of respondents. So that's not really a key finding, but something important to consider as we look at the rest of this data, but also for any interventions that we look at as a result of this. The prevalence of multi-morbidity, is over half of the respondents. So it's not a case of focusing on interventions for just one condition perhaps. It's looking at those conditions combined as we focus on people rather than the condition. So the digital inequality questions, we asked 2 questions about this, because digital inequality can exacerbate the effects of social isolation, and SASP found this out through the early stages of COVID, when we developed some active at home packs ourselves to send out to people on the shielded list and people isolating and older people. And we realized, without the face-to-face kind of activity and contact that we're used to having, how do we access the older population that don't have digital access? That was a real challenge for us. It was key that we included these questions in the survey. And we asked about access and we asked about confidence, because it turns out that they're 2 distinct capacities. So the pie chart on the left here is a simple yes or no question. Do you have access to a digital device and the internet in your home? And we were really surprised about the response rate there, with 84% of people saying that yes, they do have access. We thought that would be a smaller number. And it's the confidence question where we saw that's probably where the problem lies. It's not so much the access, but you've got double the amount of people that have low or no confidence in using those digital devices. So that's something for us definitely to consider as we move forward. So it's digital access is actually quite high, but it's the digital confidence that was much lower. So then onto the physical activity levels. Just as a brief overview, the general government guidelines for adults and older adults recommend a minimum of 150 minutes of moderate intensity activity. We were interested in physical activity levels, but we weren't that interested that we were going to ask multiple questions on it. So we used a single item measure, which was just on how many days over the previous week have you done 30 or more minutes of moderate activity, which was defined as activity that would be enough to raise your breathing rate. And there's a number of inherent sort of issues that self-report measures of physical activity are susceptible to, so biases. And the summary of that response is to be taken with a pinch of salt, but it gives us a general overview. One of the issues with that question, which was actually brought up after we analysed the data and we were speaking with one of the members of our CCG, was that the wording in terms of raising the breathing rate might have been a bad choice, considering the makeup of the shielded list, and you'll see later on in the next slide the number of people with respiratory disease. So it's again, as I said, take this one with a pinch of salt, but you can see those that a quarter of people reported 0 to 1 days, and then almost half reported 5 to 7 days. But it was actually over 25% of people reported 7 days being active on 7 days. And I don't know about you, but that's not the case of me. So I'm wondering how accurate that information is. But the more interesting question that we did ask was about the change in activity levels. So that was more interesting to us and perhaps is a more valid question. So compared to a typical week prior to COVID, did you do more, less, or the same activity in the previous week of shielding? And you can see a third of people have done less. So that tells us what we wanted to know. And that's quite a concerning change in physical activity. But again, what was interesting with this is there was actually no difference in those physical activity levels across gender or age. So you typically expect to see males report slightly higher levels of activity. And of course, you'd expect to see activity levels decline with age, but that wasn't the case with these self-reported numbers. But with the change in activity levels, females were more likely to have reported doing less physical activity than prior to COVID. But again, no difference with age. So just carrying on with the physical activity and looking at how that relates to the long-term conditions. The conditions over the top corner here were the most frequently reported, with 39% reporting respiratory disease, followed by chronic pain, cardiovascular disease, and then cancer and diabetes. And this figure in the bottom left has broken down those physical activity, those self-reported physical activity levels by those conditions. And you can see that cardiovascular disease was the most inactive and the least active, closely followed by diabetes. And again, it's difficult to draw too much information from these because of the prevalence of multi-morbidity that we spoke about earlier. So some of these people reporting respiratory disease are also reporting cardiovascular, etc. But again, it gives you an overview of where some of these priority conditions might be. And the other figure on this slide is sort of a simple graph here, but it shows the days of activity reported by those with 0 conditions, 1 condition, etc. And interestingly, there's no difference between the activity levels reported by those with no conditions and those that report 1 long-term condition. It's when multi-morbidity comes into it that we see those activity levels starting to drop off. So that's definitely something to consider for future interventions. Is 2 conditions the minimum for priority of starting to intervene, or perhaps do we try and target the population with just one long-term condition before those activity levels start to decline, while they're still relatively active compared to the healthy population? Okay, we also asked about physical activity types, and you can see the most frequently reported types on the left-hand side here. So walking, 79% of people, I'd expect that, to be the highest one. But also many of the activities reported relate back to sort of the self-report issues of activity that I was talking about. So a lot of the activities wouldn't be indicative of moderate activity, so gardening and housework. But concerningly, maybe 10% of respondents reported no physical activity, or specifically stated that they had performed no activity. So then we asked some questions around sort of physical activity attitudes and perceptions related to COVID and physical activity in general. So it was on a scale of strongly disagree up to strongly agree, represented by the colours here. So you can see that the majority of people strongly agree or tend to agree that they find physical activity enjoyable and satisfying. And this changes a little bit when you ask about whether they find being active on their own enjoyable. Quite a few more people tend to disagree with that, which is important when we're looking at those shielding or those isolating and the ones that are living alone. We then asked about sort of the opportunity and the confidence to be active, and the responses here were quite positive again, with people agreeing that they have the opportunity and the confidence. And what I should have mentioned earlier on at the start was the timing of the male drop. So this survey went out to those on the shielded list towards the end of shielding. So the logistics of the actual project took a while to get everything together. So it was delivered towards the end of shielding, as I think towards the end of July. So these responses may have been more the other direction if we'd asked earlier on in shielding, but I think there was the expectation that they'd be coming out of shielding soon. But it's worth pointing out that these numbers here of people reporting that they strongly disagree that they have the opportunity and confidence with our sample size, these aren't insignificant numbers of people, these are hundreds of people. And then the next question here, positively, the overwhelming majority agreed that it's important to be physically active regularly. So it's good to know that that message is already out there, that people are aware it's important to be, but it's now we ask, how do we get those people active? So again, apologies, these are quite busy slides. I'll try and talk you through this. If we just focus on the top figure here at the moment, this is looking at digital confidence with low and high, low on the left, high on the right. And the green bars represent the confidence to be physically active, and the yellow represent the opportunity to be physically active. And you can see that it's the case for both the confidence and opportunity is a lot lower in those with low digital confidence than it is with high digital confidence. And it's the same case when we look at household instead of digital confidence. So the confidence to be active and the opportunity to be active is much lower in those living alone compared to those in a household of 2 or more people. So it's as we were looking at this data, it was when we started to realize that perhaps these are probably the 2 most important factors that are contributing, or related rather, to lower physical activity, lower confidence, and other issues. And the next slide here kind of focuses on those 2 factors. So again, living alone and digital confidence are related to all of these negative outcomes. Of course, the outcomes are related to themselves as well, but it does just give us an overview. So you're more likely to be less active than pre-COVID if you're living alone or have low digital confidence, or both. More likely to have multi-morbidity, more likely to worry about leaving the house, have lower physical activity levels, more likely to feel COVID-19 has impacted your activity, and more likely to be older. And of course, the risk factors that come with that. And the 2 variables were strongly associated with each other. So if you lived alone, you're more likely to have low digital confidence, and vice versa. So then, as I mentioned at the beginning, we asked about the barriers and motivations to activity. So we've talked about who are the people that are more likely to have lower activity, lower confidence, lower ability. But now we wanted to know, what's stopping them and what might motivate them. So how can we help? So the barriers here, access and facilities was the most frequently reported, which is probably COVID-19 related. So access to leisure centres, other outdoor activities, that sort of thing. But health, again, was in second place, was a quite important one to people. So it's those people with long-term conditions feel that their health is a barrier to them being active. So the current situation has impacted my activity. Although more people agree, again, these aren't insignificant numbers here. More people agree than disagree that the current situation has impacted my activity. So that's understandable with shielding, being asked to stay at home for that long. But interestingly, not too many people were worrying about leaving their home to be physically active, or rather more people disagreed with this statement, which I thought would be in the other direction, but that's interesting that people aren't too worried. But again, that might be the case that this survey was presented to them in July towards the end of shielding. So ability, again, was a barrier that came up. Transportation, which is probably Somerset related, again, to the rural geography and the lack of transportation, and other sort of significant numbers of reported barriers: energy and tiredness, work, lack of motivation. But positively, actually 13% of respondents specifically reported that nothing stops them from being active, which is good to hear. So then the motivations. Health, again, you can see the standout here. Over half of the people saying that health is what most motivates them to keep active, to be active. And it's interesting that health is both, a huge motivator and a huge barrier. And it's interesting to consider how do we approach that going forward to try and motivate people to be active. And you can see here that, again, I think this is what we covered in the previous slide, that the overwhelming majority find physical activity to be enjoyable and satisfying, which is positive. And in this case, only 3% of respondents specifically reported that nothing motivates them to be active. And so, yes, I spoke about the We Are Undefeatable campaign. We mentioned this briefly. It's a national campaign to encourage people living with long-term conditions to find ways to be active that work with them and not against their condition. But Somerset has one of the 10 local activation areas in the country to activate that campaign locally, so beyond the national TV adverts and press, to try and activate this locally. And we've done this with local ambassadors, so we've recruited people with long-term conditions to promote and amplify the campaign for us, and various other local activation activities. So we wanted to know, there's national evaluation at the national level, but we wanted to know, with this opportunity for the survey, we thought we'd include some questions about We Are Undefeatable. So we asked respondents, if they recognised the logo, which was included on the letter, and the letter included a sentence or two about the campaign. So not a lot of information, but I think 1 in 5, we were pleased with that. That's a positive level of recognition, considering we didn't give much of a prompt other than a small logo and a brief outline of what the campaign was about. And then we asked those people how relevant they felt the campaign was to them. And so that of those people that recognised the campaign, 2/3 felt that it was relevant to them, which is positive. And just a small note at the bottom, the recognition was actually higher in those that didn't have digital access. So that could be just the population that it was aimed at, but it was probably related to the way that we have tried to activate the campaign locally, knowing that digital access and confidence has been an issue. We very much focused on sort of analog media, the local press, radio, and more face-to-face interaction than social media with this campaign. And finally, we asked those on the shielded list, we left this as an open question, but we asked what sort of information and support would you be interested in, what would you find useful to help you get active. And the overwhelming majority of people left this blank or put a question mark or said they just don't know what would be useful to them, which was an interesting finding in itself. But of those people that did respond, these are a few of the common themes that were coming through. So age and ability specific groups, walking groups, improved walking and cycling infrastructure. And the final point here would be that we included the option for people to give us their contact details, so name, address, and email address if they had one, if they were willing to receive follow-up from this survey, whether that be another survey or be contacted in the future to contribute somehow. And we were really surprised and really pleased with the response from this. So as it last stood, it was 1,800 or over 1,800 respondents that provided this information. And a lot of those included emails, but that's email or home address. So we've now got a database of these people that we can now follow up with after we've finished presenting this data to people, analyzing the data, and decide on what we want to do next. We've got these groups of people that we can approach, whether it's a similar survey that we follow up with, or if we look at some more in-depth analysis in focus groups or interviews, we can pick a particular group of people to focus on. So it might be those people that are motivated by health. So say, speak to those people and say, why are you motivated, and how do we get other people who aren't motivated to be more active? Or on the flip side, we could focus on those that say that health is a barrier and talk to those whole focus groups and say, how can we help you? What would encourage you to be more active? They're just two examples off the top of my head, but we've got a lot of responses from people, and it's now deciding on how we move forward and approach that. So I'll hand you back over to Jane. That's just a brief overview of the data. There will be an insight pack available and a spreadsheet of the data table, so you can actually look at each question and the percentage of responses for each answer. But Jane would now give you some more information about our immediate response after the survey.